PM2.5 is responsible for anywhere between 4 and 9 million deaths from chronic diseases each year. So that's how dangerous that pollutant is. It's also exacerbating the impacts of COVID-19 with a significant number of COVID-19 deaths attributed to PM2.5. In terms of nitrogen dioxide, among other impacts, it's responsible for an estimated 4 million new cases of child asthma each year.
Are the new WHO limits going to make any difference, given that it seems that most countries at the moment don't even manage to meet the current standards?
For PM2.5, you're right that most countries don't meet the old guideline. So in terms of that pollutant, I'm afraid that for most countries, the most that this does is highlight how far their current pollution levels and their current standards are from what would be considered truly safe levels. And we can hope that that catalyzes some action.
And this week, Chinese President Xi Jinping announced at the UN that China will stop building coal-fired power plants around the world. What effect could this have on air pollution around the world?
China has been the largest financier of new coal-fired power plants around the world overseas in terms of international financing. Furthermore, almost essentially none of these plants comply with the air pollutant emission standards that are applied in China. So these plants would not be legal to build in China. That makes them much bigger contributors to air pollution. We estimate that there are currently about 50 gigawatts, so more than Germany's total coal-fired capacity in the coal-fired power plants that have involvement, financing, or engineering contracts from China that are not yet under construction that could be affected by this announcement, which would of course be immensely significant. The carbon dioxide emissions from these plants, if they were built, would have been roughly equal to the CO2 emissions of Spain. So that's how significant the cancellation of these plants could be in terms of global emissions.